exercise salt in case the Ritz cracker, because sometimes, even though it says like there's some salt on it, there's no salt on it. There's no salt. There's no salt. There's no salt. So yeah. Oh, this. It looks like a halter top, right? Or I don't know. Is that what these are called? But guess what? It's actually a long sleeve that I flipped. Yeah. So cute. I love. But I do think it makes me look more grown than I am, so I'm probably never gonna wear it. You know what I mean? Yeah. But yeah, I have my textbook. It's humongous. It's my whole ass face. My whole face. And it's so heavy. Jesus Christ. But there's like 1,000 pages in here. It's super heavy. I carry it around. I used to carry it around with me everywhere at school, but I stopped doing that because, oh my gosh, it's so freaking heavy. But yeah, so this is The Language of Medicine, 13th edition by Davy Ellen Chapner. Davy. Yeah, so I have to read chapters 11 and 13, and I am almost done with chapter 11. I have 8, not 1, not 2, not 3, not 4, not 5, not 6, not 7. What the hell? But 8 more pages of chapter 11 left, and I have not even started on chapter 13, and I'm pretty sure this week's quiz is on chapter 11 and 13. So, and then I also have homework for this and more readings. Oh my, it's like freaking 100 to 130 pages every freaking week that we have to read, and you know. But first, we're gonna open my drink. I'm scared it'll spill. Okay, so I opened my drink and I cut it off because there was a humongously loud and sharp type of sound. It hurt my ears, and I'm not even like, you know, so. Oh, also I lied. I have drank this once before. Sorry. Okay, you can have a sip too if you want. Boom. Oh, that looks nasty up close. Boom. Then I'll have the second sip. Oh, that's good. I don't even know if you can hear that. Maybe you don't like hearing swallowing sounds. But I'm gonna close the lid back on this because I'm scared this will spill everywhere. Okay, all closed tight. Okay, I opened my book. small holes in the wall between the arterial septal defects or the ventricles, aka the ventricular septal defects. Although many septal defects close spontaneously, others would require open heart surgery to close the hole between heart chambers, or they may be repaired through minimally invasive surgery using a catheter inserted through a blood vessel leading to the heart. A heart-lung machine is connected to the patient's circulatory system during open heart surgery to relieve the heart and lungs of pumping and oxygenation functions during the surgery. The tetralogy of follow. Maybe the T silent, I think it is. The condition named for Etienne Louis Follow, the French physician who described it in 1888, is illustrated in figure 1116b. Yeah, let me see if I can pull that up and show it to you. It's, oh my gosh, this thing right here. Oh my gosh, hello. The 4 defects are pulmonary artery stenosis, which means that's the lung artery, narrowing. Pulmonary artery is narrow or obstructed. There's the ventricular septal defect, large holes between two ventricles, lets venous, venous, I don't know, blood pass from the right to the left ventricle and out to the aorta without oxygenation. Shift of the aorta to the right. Aorta overrides the interventricular septum. Oxygen poor blood passes from the right ventricle to the aorta. Hypertrophy of the right ventricle. Myocardium works harder to pump blood through a narrowed pulmonary artery. An infant with this condition is described as a blue baby because of the extreme degree of cyanosis presented at birth. Surgery for tetralogy of Follow includes a patch closure of the ventricular septal defect and removing obstructions to the outflow at the pulmonary artery. Other congenital conditions such as transposition of the great arteries, TGA, which is where the pulmonary artery arises from the left ventricle and the aorta from the right ventricle, cause cyanosis and hypoxia as well. Surgical correction of TGA involves a arterial switch procedure. The pulmonary artery and aorta are reconnected in their proper positions. Congestive heart failure. CHF with a reduced ejection fraction, and a heart bundle branch block, cardiac resynchronization therapy, CRT, devices may be used. These implanted devices consist of a pulse generator and thin insulated wires and function like normal pacemaker and defibrillation devices. If drug therapy and lifestyle changes fail to control congestive heart failure, heart transplantation may be the only treatment option. While waiting for a transplant, patients may need a device to assist the heart's pumping. A left ventricular assist device, LVAD, is a boost pump implanted in the abdomen with a cannula, which is a tube, inserted into the left ventricle and the left, not the right, the left. It pumps blood out of the heart to all parts of the body. The LVAD may be used either as a bridge to transplant or a destination therapy when heart transplantation is not possible because of the severe shortage of heart donors. Research efforts are directed at developing total artificial hearts. Wow. What is this? A coronary artery disease. CAD. The coronary arteries are a pair of blood vessels that arise from the aorta and supply oxygenated blood to the heart. After blood leaves the heart via the aorta, a portion is at once led back over the surface of the heart through the coronary arteries. CAD is usually the result of atherosclerosis. This is the deposition of fatty compounds on the inner lining of the coronary arteries, or any other artery can be similarly affected. The ordinarily smooth lining of the artery becomes roughened as the atherosclerotic plaque collects in the artery. The plaque first causes blocking of the coronary artery. Next, the roughened lining of the artery may rupture or cause abnormal clotting of the blood, leading to thrombotic occlusion, blocking of the coronary artery by a clot. Blood flow is decreased ischemia. I know the word, I don't know how to say it. Or stopped entirely, leading to death, necrosis of a part of the myocardium. This sequence of events constitutes a myocardial infarction or heart attack, and the area of dead myocardial tissue is known as infarct. I hope I'm saying that right, because I feel like I'm not. The infarcted area is eventually replaced by a scar tissue. Acute coronary syndromes are conditions caused by myocardial ischemia. These conditions are unstable angina, which is chest pain at rest or chest pain of increasing frequency, and myocardial infarction. Patients with ACS, which is the acute coronary syndromes, benefit from early angiography, X-ray imaging of coronary arteries, and PCI, percutaneous coronary intervention with a balloon blood flow to the heart muscle, revascularization. Drugs used to treat ACS are anticoagulants and antiplatelet agents such as aspirin and clopidogrel, Plavix, prasugrel, efficient in ticagrelor, Belinda. Girl, I don't even know what I'm saying. For acute attacks of angina, nitroglycerin is glycerin is given Venodilation to reduce venous return and decrease myocardial oxygen consumption, both of which help decrease the work of the heart. Physicians advise patients to avoid risk factors such as smoking, obesity, and lack of exercise, and they prescribe effective drugs to prevent CAD and ACS. These drugs include aspirin to prevent clumping of platelets, beta blockers to reduce the force and speed of the heartbeat and to lower blood pressure, the mitral valve enlarges and prolapses into the left atrium during systole. The physician hears a mid-systolic click on the auscultation. And occasionally mitral regurgitation, which is backflow of the blood into the left artery atrium. Most people with MVP live normal lives, but severely prolapsed valves can be associated with severe mitral regurgitation and on rare occasions may become infected. Oh my gosh, I don't know if I can keep reading, guys. Like, on camera, you know what I mean? This is gonna be a long video. It's gonna be about like 26 minutes of it long. 26 minutes long, I think. But I'll finish this page. At the very least, a murmur is whenever there's an extra heart sound heard between normal beats. Murmurs are heard with the aid of a stethoscope, and usually are caused by a valvular defect or disease that disrupts the smooth flow of blood in the heart. They also are heard in cases of interseptal defects in which blood flows abnormally between chambers through holes in the septa. Functional murmurs are not caused by valve or septal defects and do not seriously endanger a person's health. I don't know, is a murmur heard on auscultation. It is the turbulent flow of the blood through a vessel. A thrill is a vibration, a vibration, a vibration, a vibration, a vibration.